Ladies and gentlemen, please join me in giving a large welcome to Dr. McCloy.
Tonight. I want to thank you for joining me, joining all Americans who love freedom to stop this Obamacare. We're standing up for our health. We're standing up for our seniors. I'm going to be a senior soon. And we're standing up for our liberty. You know, the president says, if you like your health plan, you can keep it. He says this bill is voluntary. But the bill itself proves that's not true. This bill is going to force you to buy the health plan the government says you should have. It's on page 16 and 17. They say you can keep your health plan. Not true. You're going to have a grace period, and then you're going to be forced to give up your health plan and be in the plan that's designed by the government. It says private insurance, but all those plans are going to be the same basic plan with the same basic benefits. And guess what? You're not going to hear what those benefits are until 18 months after the bill is passed, and you're already legally stuck in it. It's like, in some places in the country, they call that buying a pig in a poke, right? You're not going to know what the plan costs or what's going to be covered until after the bill is passed. You're supposed to trust your government.
Not a chance.
And when you go to file your taxes, if you haven't enrolled in what they call the qualified plan, you're going to be fined thousands of dollars. Does that sound voluntary? Absolutely not. But the worst part about this is who's paying for it?
We are.
Yeah, the trillion to $1.6 trillion price tag for this bill. We've all heard about the tax hikes, but half of this bill is going to be paid for by cuts in Medicare. $500 billion reduction in future spending for Medicare. That's a 10% reduction in the Medicare budget when 30% more people are going to be in Medicare. And they say it's not going to hurt our seniors? It's going to mean fewer knee replacements, fewer hip replacements, fewer bypasses, fewer angioplasties. You know, one of the wonderful things about this country is that over the last 40 years, our medical science, our doctors, have transformed the experience of aging. 40 years ago, you reached a certain age and you were trapped in a wheelchair with crippling arthritis, or bone deterioration, osteoporosis, or you were so out of breath from clogged arteries that you were trapped in a nursing home, unable to walk. Not anymore. Those 4 procedures I mentioned and many others have really enabled all of us to enjoy our later years. And Obamacare is going to undo that. We have to stand up not only for ourselves, but for our parents and our grandparents, and make sure that what they've spent their whole lives paying for, serving this country, paying their taxes, and now they're going to take it away? That's an outrage. And finally, where are New York's representatives? Where?
Here it
This bill is death for New York's hospitals. Obama says he's going to slow the flow of dollars into health care. Healthcare is the major employer in this state. Columbia Presbyterian, one hospital, employs more people than Time Warner or Macy's. This is going to mean huge cuts in hospital budgets in New York, fewer nurses on the floor, fewer MRI equipment, long waits for treatment, and big layoffs. But the most important reason of all to fight this bill is it's taking away our freedom. We don't want the government telling us what our doctors should do, what kind of health insurance we should have. That's our business. The people in this room feel great affection for this country. 1776, we beat back the British and won our freedom. World War II, we defeated fascism and saved the world. And now it's time to save our own freedom.
format will be this. We will take hands from the audience. You'll be limited to a 2-minute question. Dr. McCoy will respond. We try to keep those questions as different as possible, so if you've heard a question similar to your own, please don't repeat. I'm going to start off asking 2 questions, and then we'll turn to the audience. Dr. McCoy, when the Medicare program was first established, it was a 28-page bill in Congress. This bill is over 1,000 pages. Do you believe any of our representatives will actually take the time to read the legislation before signing it?
It's a shame. It's a shame that these bills are so big and inscrutable. That House Bill 3200 is 1,018 pages. The Kennedy bill is about 859 pages. But it's not just the length that's so bad. When I read through the Kennedy bill the first time, I was amazed that in the last 500 pages, it's just crammed through with programs that have nothing to do with protecting our health care. Just lots of spending on other things. And that's why it's so important to read these bills. But unfortunately, many members of Congress don't read the bills. And I don't have high expectations that they will. I've heard many officials in the Obama administration say the bill hasn't been written yet. I wonder what that is sitting on my desk. Another question.
Doctor, just to follow up on that. Now the Obama administration has moved from saying that this is about health care in general to about insurance reform. But only 6 to 9 pages of this bill, that's over 1,000 pages long, actually deals with any form of health insurance reform.
That's right. The very first section does accomplish some important things in terms of protecting us from insurance abuses. And I remember when I was in government way back in the 90s, we accomplished some very important things in New York. We were one of the leaders in outlawing drive-through mastectomies, forcing women out of the hospital just hours after a mastectomy. I remember one of the insurance companies telling me that it was okay to expect your husband to change the bandages and drains. It would bring you closer together. And remember drive-through childbirth, less than 48 hours after childbirth, women were being forced out of the hospital. So we've accomplished a lot in terms of preventing those managed care abuses. And there are some important reforms in the first 6 pages of this bill. But the real truth is, this bill is going to force you out of that wonderful fee-for-service plan. Those of you who are lucky enough to have one of those Blue Cross Blue Shield type plans where you go see the doctor when you want to, or a high deductible plan, which is so affordable for young people, just covering them if they have an accident or an unforeseen diagnosis. No, you're not going to be able to keep those. You're going to be in a managed care style plan, because that's what the qualified plans are going to be.
The second question is just related to healthcare in general. Looking at every other nation in the world that's moved to socialized medicine, we find that almost 40% of the people with critical care needs look to the United States for potential health care. What will be the impact of moving the United States to socialized medicine when all the countries in the world with socialized medicine who have acute care cases want to come to the United States?
Of course, the biggest impact will be on medical innovation, because so much of the breakthroughs in medicine occur in the United States, and the great specialty departments right here in New York. In fact, one of the most damaging parts of this legislation is the enormous shift in funding from specialty departments to primary care, on the mistaken notion that primary care is good enough. But the research shows that if you have heart disease, for example, and you rely only on a primary care doctor, you're much more likely to be misdiagnosed and incorrectly treated and die sooner. And those same specialty departments are where the real breakthroughs occur, where the clinical trials are conducted, and where doctors at bedside discover the new use of an existing medication or the importance of a new medication. And a lot of that is going to go by the wayside.